Government is looking for public input into long-term plans for economic development. In a meeting held yesterday, Honourable Premier Toke Talangi says that an invitation was extended to non-government organisations to voice concerns and also present project priorities for 2011-2012. Representatives from the village councils, private sector and civil society had open discussions in regards to tourism and economic developments on the island and how government and NGOs can work together for the welfare of the people. Some sentiments shared highlighted the need to focus on maintaining the population currently on the island who are determined to live in Niue, amongst other things. Premier Talangi says that groups have been asked to return with a list of needs and priorities for government to consider. Some of government's long-term plans are to focus on the maintenance of Niuean culture, progressing forward with the developments of Taonga Niue, and a proposal to relocate the Niue Primary School. Premier Talangi will be leaving the island tomorrow to sit on a panel for climate change discussions in Vanuatu. Improving health services and forward planning was the main purpose of public consultations held by the Niue Health Department as they look at developing a 10-year strategic plan for health. Matt Allen, an independent consultant from New Zealand, was on the island last week meeting with a range of people to gather and compile information on current health services. Director of Health Anne McLean says that there has been a lot of public support.
There's a lot of public support and recognition of the enormous amount of work that we're doing in public health, in terms of controlling non-communicable diseases and all those things that we have on the TV as well. So there was a lot of accolades for that. Some of the areas that they thought that we should improve was keep on doing procedures here or operations, which we are doing. We did 2 gynecological operations yesterday, so we are doing that, but the message was to continue on with that. Some of the other things that came out was that we really needed to look at aged care in terms of what we're doing with aged care. And I guess I would agree that we haven't got the model right at this stage. There are people who live in the village, and then when they can't care for themselves, they come to the hospital unit. And really the message was that perhaps we could look at either a step-down supported accommodation, but wasn't at hospital level care, but they just have some assistance, or more perhaps community outreach programs, Meals on Wheels, going up a bit more, district nursing, supporting people a bit more in their own homes when they're getting older, and obviously all their families are working. So we do need to look at that model. I suppose one of the other things that came up, which raises its head from time to time, and we will need to look at, is dialysis machine. That does get discussed at a lot of forums.
Why was it necessary to bring in a consultant to develop this strategic plan?
Well, I think twofold. There's going to be a lot of work that needs to be done in sort of writing and putting together the ideas. And in fact, actually, what Matt has got already is, in terms of the draft that we were working on before he left, is about this thick. And while I do have the ability to do a strategic plan, I don't actually have the time to put together a piece of work of this size. The other aspect that I was quite keen on was that we do need to do some work in projecting out to the future in terms of health needs analysis and determining what we need in the next 10 years. And I didn't really want it to be something that the public would say, well, that's the Director of Health's view of what we need to do in the next 10 years. So I wanted it to be a little bit independent and have something that can be peer reviewed with outside of just a wish list for Niue, really.
How much this will all actually cost is also uncertain.
It's hard to know at this stage the total cost, but under the technical assistant program, which the government has for which is about 300,000. I think there's been about 40,000 set aside for that piece of work. It is quite an extensive piece of work that will be undertaken. Not just, it's not really visible the work that Matt's doing, but on his week here, he's doing a lot of work behind the scenes, and he's really sort of started work on this early February.
So when is this strategic plan most likely to be completed?
We're hoping to get the first draft by the end of March or early April to go out for consultation. And then I will need to do an operational plan underneath that about what we need to do in the next year to make that happen in the next 2 years and so on. But it will be a plan projecting out what the population needs for the next 10 years.
The plan is becoming quite complex with different scenarios on how health services needs will be affected by population, whether it increases, decreases or remains the same. The public can also expect some changes and improvement in the current services.
We will clearly continue to do more operations here. And we have the surgeon who is coming back, Dr. June, who is coming back in March. And clearly this year we have already done more operations than we've done before, and we will continue to do that. That is a good way to manage our referral budget overseas, and we have the skills and expertise to do it here, so we'll continue to do that. The visiting specialist program, we're continuing on that program, but we will perhaps need to change the range of visiting specialists. Partly that's to do with an ageing population and the increase of non-communicable diseases. So do we need more diabetes nurse specialists visiting here, more orthopaedic surgeons, that sort of stuff. So we need to look at that. In terms of improving the services, as I said, the key one for me is really looking at aged care and how we can do that better to meet the needs and actually involve the community a bit more in it.
It is expected that the first draft of the strategic plan will be available in late March or early April. Continuing questions about the 10-year change in the immigration bill has been discussed in depth, both with Niue and overseas, and locally is just as popular as when the bill was passed in the House of Assembly. Today we spoke to the Minister of Immigration, Honourable Premier Toki Talangi, about people's views of the biggest change of the bill and permanent residence applications received by government.
We're still waiting for the Immigration Department to get us this list. They're going through the list to make sure that in fact everybody is encapsulated. Let me make clear that in fact the fact that they're on the list will be treated as a person applying normally for PR status. It doesn't automatically mean that in fact we're going to approve all of them. But what we wanted to do in the old act or in the new act is to make sure that they are treated separately, because they've already got the applications in the pipeline and we should consider them. Let me also say the reasons why we have deferred decisions on the PR applications is the risk to us, to the newer government and newer people, of any of these PRs without New Zealand citizenship having an accident and going to New Zealand and costing the government. And that's really the thing that we were concerned about. We needed to determine what the risks are and how we can assist in that process, and to make sure that if there is such an event happening, then we would be able to cope with it and cover it financially as well as by way of insurance or whatever other thing. It's the same thing that we had been treating the permit holders, if you like, the workers who want to come here and work for a short period of time. We've actually asked the sponsors to guarantee that in fact they will be responsible. And most of the business sponsors have been, but some of the nuanced sponsors, even in the old system, were starting to become hesitant about those onerous responsibilities they have.
Now, do you think there'll be a positive response from Cabinet to these people whose applications have been in the process?
I'm pretty sure that Cabinet will consider their applications in light of what's happening. I mean, the fact is, if they have to wait another 7 years, then that would be unfair on them in terms of the applications being put in within the time frames. But I can't guarantee that we will approve all of them, because the criteria that they have to meet obviously still apply as well.
Now, there's also some concerns from those who fall short of the 3 years previously, and then suddenly, there's this drastic change to 10 years. Will you consider them as well?
No, we're not. We've made that very clear. It's only those people who have made the applications and so on that we will consider.
Some other confusion is whether the sponsor is allowed to leave Niue when the person sponsored has no permanent residence permit.
And the rules have been tightened to ensure, in fact, the sponsor is made aware of his responsibilities or her responsibilities. Let me also make clear that the provisions for the sponsor to be certain that they will be here to look after the person they're sponsoring on a long-term basis is made on the basis that they've got to accept the responsibilities for that person. But there is absolutely no reasons why they can't, by applying to the minister again, if they have an urgent need to go overseas, to in fact apply and seek dispensation on that basis. But they've got to have somebody else responsible to take over those responsibilities. So the law is not inflexible in that respect. That's for permanent residents. In terms of people who come here for work permits, I don't see any particular difficulties. The law still applies, and the people who are bringing in temporary workers are still bringing in temporary workers.
That is Minister of Immigration, Honourable Premier Toki Talangi. To end our news bulletin for tonight, the new Health Department program to check the state of health of students concluded yesterday. Health checks in schools are usually done on an annual basis. However, the program in Niue has lapsed 3 years since the last health check program, so this is a long time coming. Last week, Niue primary students were part of these annual checks, with health staff for a head-to-toe holistic health check, which took 4 days to complete. Niue High School students had their checks done this week. Health staff involved in the process say that the program has progressed smoothly and that this time round there has been great support from parents. One of the exercises with a finger prick test to test for iron levels required parental consent, but other than that, it has been successful. The school health checks are important in determining the state of health of students and to detect any health issues that would otherwise go untreated. That's our news bulletin for tonight. Good evening.